are a form of gas exchange, right? But one is called respiration and the other is photosynthesis. So you guys understand that breathing and respiration is not the same thing. And it's very important. If we don't exchange gas, why do I care about oxygen? Because because essentially it goes to the brain, and that's where you need it. I mean, you need it everywhere, but you need it the most to think, okay? So as we look at the diaphragm has the red muscle around it, and it has a very significant, like, fibro tension, and piercing the diaphragm are a couple of veins and a couple of arteries that you guys don't need to know about, but they're very important. And so the diaphragm separates the thoracic cavity and the abdominal cavity. And so what are we doing in yoga with our respirations? When we inspire, what happens to the diaphragm? It expands, but it goes down, right? And why does it go down? Because you are expanding the lungs. So the lungs are pressing down, and you're making one of the ways to think about it is you're making the thoracic cavity big, and you're making the abdominal cavity small. And then what do? When you compress your diaphragm, and you think about a baby. How does a baby breathe? And we lost that because our rib cage is got. So the babies breathe through the abdomen. If you've seen a baby sleep, they go up and down. Their little bellies go up and down. They're so cute, right? And that's because most of they're using their stomach to move the diaphragm. Okay, so the diaphragm, most of our exchange, 70 to 80% of the gas exchange and of the breathing is done through the diaphragm. Then we have these other muscles here, the intercostal muscles, which are the muscles in between the ribs, right? And they are what we call accessory or secondary muscles of breathing, right? So it's important to expand our thoracic cavity in order to breathe better, right? And we do that through training of these muscles. That's why one of the reasons, so, the sages that came up with yoga, they understood that the gas exchanges and the knowledge and depth of your breathing would be very important. Why? Because without knowing that it changes the pH in the body and this and that, they understood that that would bring you to a different state of mind. Controlling your breathing, being able to breathe deep and long and doing breathing exercises changes the metabolism of the brain and starts activating what we call the parasympathetic system. What is the sympathetic and parasympathetic system? These are nerves in our bodies, right? And if you want to call chakras your centers of energy, your nerves, right? We have bundles of nerves that are, the brachial plexus, the lumbar plexus, so our sacral chakra, the abdominal, the thoracic, the throat, right? These are centers of energy. We're bundles of nerves, the mesenteric nerves. They didn't know about these nerves necessarily, but they knew that these were centers of energy that needed to be activated in order for you to go from a day-to-day fight or flight, adrenergic, noradrenaline kind of life, to a more parasympathetic relaxation, taming of the mind, if you want to put it that way, rhythm, right? Of course, they didn't have children to deal with. They didn't have, to pay bills or anything like that. So they could afford to stay in a state of meditation for days, right? Yes?
Okay, so I understand the benefits of bigger breathing capacity and everything, but when we're doing like the Kapalabhati, like the breath of fire, where we're just using our diaphragm, then how does that affect?
Okay. That I'm going to have to explain in a little bit of getting into the pH of the blood and all of that. So essentially what happens when you are breathing fast, you are expelling CO2, right? CO2 is a vasodilator. And so you change the arteries in your brain, the size and the ability of them. So you create a respiratory alkalosis, right? So some people, for example, if I do a couple of potty breathing for a long period of time, and that's very common, people will have a headache. You'll get a transient headache because you're changing your pH. All of us have a state of relative acidosis or alkalosis. The human pH is between 7.35, 7.4245, right? More acidotic, more alkalotic. And we live with that, and our cells live in a optimal, what we call homeostasis, in that state. So when you're doing your Kapalabhati breathing, you have a change in the pH. You have tingling in the fingertips. You can have tingling around the mouth. You have, so they knew that empirically. Did they know about pH? And no, they didn't know that. They knew that brought, after the Kapalabhati breathing, that brought a state of relaxation. It's not the Kapalabhati breathing in itself. It's what it brings after. You breathe hard and fast to ripe the benefits of that for a couple of seconds later. Okay?
More like oxygen,
It's
almost like you're an oxygen bar, kind of.
in a way it is. Okay. Right. It has more to do not so much with the oxygen, but with kind of the changes in pH. The balance, okay? So, and also when you have a more alkalotic pH, you activate the parasympathetic system, okay? And the parasympathetic system makes you relax as opposed to the adrenergic system, okay? So this is what it's talking about. Inhaling through the nose, expanding your lungs, compressing your belly. So when Gray does a class, he also asks you to put one hand on the belly and one hand on your chest. So you can do that exercise. And if it's in a baby or in a child, you'll see that go up and down a little bit better and faster than we do, because we very much get, as we become adults, our thoracic chest to protect our lungs get bigger. The babies have a big abdomen, right? And so we have a bigger thorax than an abdomen, right? And so that's why. So the belly contracts, the diaphragm relaxes, and the lungs then become smaller, okay? So that's, if you all close your eyes and just do a couple of breaths and think about your diaphragm going up and going down, going up and going down. Also, close your mouth and just breathe through your nose. The other thing that you will notice is that some of the neck muscles, don't you feel that some of the neck muscles help? Or not? You don't need to believe what I say. Yeah, so these are called the accessory. These are also accessory muscles, right, of respiration. The sternocleidomastoid is one. You guys have never seen, but if you have an uncle or somebody that smoked all his life and has shortness of breath from COPD, right, from smoking too much or something, you will see that, or anybody that you see in the supermarket, for example, you will see that person that is breathing with difficulty, they're not breathing, they can't expand their thoracic because their lungs are diseased, so they don't expand here, and they use these guys. If you see a child in an asthmatic crisis, right, an asthma attack, that's what they're doing. Yes?
So I've taken like yoga classes where the instructor will say, okay, and it was like mostly full of girls, because a lot of women will like resort to the thoracic breathing rather than their stomach. And I've noticed like when you try to take a breath in with your stomach and your ribs, personally for me it feels like I can't get enough in, but then when I do it with just my ribs, I feel like I can get more.
So the natural thing for you all and for us to strive is to try to breathe more through the abdomen. And you can do that easier in the supine position, for example. You know, when you're laying flat, you can do that easier because the ribs just, there's no weight of gravity, right? So, but there's no right or wrong, but it's just healthier if you can take bigger breaths. And again, as they say, try to make your exhalation twice as big as your inhalation. Again, inhalation is primarily adrenergic and autonomic, meaning that you cannot go without doing an inhalation, right? But you can control your exhalation, which doesn't come naturally, right? You'll still breathe in, right? So the exhalation is the part that you can control, and you should. And it brings you a calmer state of mind. Guys, we're going nowhere. Okay, so these are like the accessory muscles, the primary muscles, the intercostal muscles, right? Even our abdominal muscles help us breathe a little bit fast. And so here we go. The breathing centers, everything ultimately, it's not because I'm a neurologist, but everything ultimately goes to the brain. Yeah. Which is the most important organ in the body. Anyway, so the breathing centers, we have very important breathing centers. We have breathing centers for inspiration, breathing centers for expiration, and they are all in the most primitive part of our brain, which is the back part of our brain, what we call the reptilian brain, because all the animals and reptiles, and they have the same thing. And so that's why when you're in coma in the ICU, they have to help with the breathing and those kind of things. And so there have been experiments where they transect, for example, a cat's or rat's midbrains, and then their breathing becomes very disturbed. And depending on the depth of the coma that you have, your breathing will be different. Okay? So all you need to know is that there are different centers in the most primitive part of the brain that regulate our breathing. And they also relay to other centers in the emotional part of our brain that's called the limbic system that make us either relax or, very frightful. And this is a small scheme of the sympathetic and the parasympathetic, which are the same. So they're nerves, and they're nerves that go to your legs and to your arms, but they don't regulate your movement or your sensation. What do they regulate? They regulate your temperature, they regulate your skin, they regulate your sweat glands, they regulate your saliva, they regulate how much you're going to have tears. So they regulate all these, how your heart is fast or slow, how your bladder, when you have a signal, oh, I need to empty my bladder. Well, guess what? That's coming from your sympathetic and parasympathetic system. Okay, so those are very important nerves, and they're all through your body. Okay, so there's one for ejaculation, there's another one for erection, there's another one for engorgement of your pelvis, there's another one for your intestine, so when you have diarrhea or when you're constipated, or all of that has to do with your sympathetic and parasympathetic system. When you take a different medication and you have a side effect and you flush, or those kind of things. Okay? And why is it important for yoga? Because again, yoga wants to bring you into a state of relaxation where you are more in the parasympathetic mode. But sometimes you have to go through hard work and do a phase of sympathetic activation. That's where you're in the middle of a vinyasa class and you are in very difficult poses. You need to remember and tell your students, breathe. Breathe through the discomfort, breathe through that sensation of fear, right? Because it is transient. And so you need to understand that when you're doing something like, I don't know, power yoga or CrossFit, or you are activating The whole time your sympathetics, your adrenal glands are like, coming out with cortisol like out of the wazoo. And that's why you need the second phase. Shh. Let's get into our parasympathetic mode. We can't live always in the parasympathetic mode, just like we can't live always in the sympathetic mode. Okay? So then, just quickly on bone anatomy, right? The bone is an active tissue. It is alive. It is constantly remodeling itself, right? So inside the long bones, you have the medulla, you have the bone marrow, right? And what does the bone marrow do? It makes blood cells. It makes not only the white blood cells, it makes white and red. It makes all the blood cells. How does it do that? Through a pluripotential cell, which means a cell that is not differentiated yet. The cell can go red, the cell can go white, the white can go leukemia, and, okay, but it makes all of them. All your bones make, well, not all your bones. Mostly in adults, the long bones, right, that have marrow, okay? So the femur is one that has a huge marrow. The pelvis has a lot of marrow, and that's where they do bone marrow biopsies and all. The sternum has marrow. The pluripotential ones theoretically are stem cells. Okay, so why do we need to know that? Is that when we have problems, so again, this is just showing that when a bone is fractured, it can heal itself and it forms a bone callus. And how does it do that? Because the bone cells are called osteoblasts and osteoclasts, right? One make more bone through calcium and all of that, and the other one destroys the bone in the sense that it is constantly remodeling the bone, right? So nowadays it doesn't happen anymore, but if one of your grandpas or somebody had a fracture, a farmer or something, and they didn't go to the doctor, they just let it heal by them, you'll see that they have a bump, they have a bone callus, because the bone didn't align correctly. And then it forms like a big blob of bone there. Okay, so for us the bones are very important because we use the alignment of the bones in our favor for yoga, right? So let's just go through the concept of our spine, which is the most fantastic and beautiful thing that we have in our bodies, right? And let's go over here through Charlie a little bit and discuss that, and then we will adjourn. No, we don't need to. Okay, so this is the human spinal cord, right? And the human spinal cord has how many segments? 5. And what are these segments? Okay, show me the thoracic, Jenny. Yeah, this one. Yeah. This is the thoracic. Yeah, Okay. What other parts? The lumbar, right here. And the cervical is here, right? And the sacrum is, and the coccyx is this. The coccyx is this one. So they're remnants of our tail, right, that we used to have. And this is the coccyx. So if you can see Charlie here, and you can see his vertebral column, and why do we have this anyway? Okay. To hold us up is one, right? So a structural thing. But then the whole reason for the existence of this, again, I'm biased, is to protect something that's inside, right? Yeah, so the brain is protected by the calvarium here, right? And then the brain, out of the brain comes the spinal cord, right? And then the spinal cord is very thin in the cervical segment. And these are, of course, all things that we put names on them, right? You can just say, okay, this is the upper blob, and this is the lower blob, and this is the middle blob, right? But we don't say that, especially if you're a teacher, right? This is the cervical.
Be careful of your upper blob.
Yeah, be careful of your upper blob, exactly. What? Yes, straighten your, okay. So the 7 cervical segments, right? So why if you look at the spine, it is not straight, right? It should be straight. Why is it not straight? So that you can move, efficiency, but to protect organs, right? So if it was just to protect my spinal cord, it could be like straight as this pole, right? I'd still have my spinal cord in there, right? And when we say spinal cord, I want you all to understand the spinal cord is that little thin thing that goes inside, and it's nerves. So it's the nervous system. It's like, remember Christopher Reeves? You guys remember anyone that, you know, from diving accidents and all that, they become paraplegic? What is paraplegic or tetraplegic? What is that? Exactly. They can't move their limbs. They can't feel anything below the level. And also, if it's in the upper cervical region, they can't breathe, right? Because C3, C4, they control your diaphragm, right? So that's why they need to be on the vent and all that. So this is the cervical spine, which has 7 segments, and this is the cervical lordosis. So lordosis is this concave. Actually, Charlie's neck's a little stiff, but you should have a normal curvature, which is the C curvature of the cervical spine. And that's what you say to your students. You want, in the Pilates class, you want to prevent the C curvature. You want to preserve the C curvature of your cervical spine. Show me a position that you're doing that is sometimes difficult, and then your neck is like, what we tend to do is we tend to like, straight, right? Exactly. So when you're doing abdominal leg lifts or you're doing any kind, what do? You're like, ugh. You think that because you're like, show us. You're doing an abdominal leg lift, and then you have to keep, that's why Lisa will say, don't put all the strength in your neck. The strength has to be here, right? Because you are straightening the cervical lordosis. If we do an MRI or if we do an X-ray, the radiologist will say, straightening of the cervical lordosis. What does that mean? Is it bad? No, it just means that you're tightening up these muscles and the cervical lordosis is gone. Yes? Yeah.
You want to elongate or
Exactly.
whatever, but I hear in classes a lot, and now I cringe because I hear, but he said it, you don't want to flatten, you don't want to straighten that low,
Right.
like you want to keep a little.
What they're saying, for example, when you are doing, when you are lying flat and you are doing holding, you know, a position like this, and you're in, you know, and you do not want a flat back ever. A flat back is wrong, is abnormal, right? So what you tend to do is exactly this. You're like, oh, you know, so all the strength is in these muscles, and you're not applying it correctly where it needs to be, right? And so that's the cervical lordosis, and you need to keep that. And that's why Shyla used to say that you would look at your toes, you would look, so you would keep your head down, and you would keep your head towards your toes, towards the midline of your body. She was very precise and brilliant about that, so that you can keep your cervical lordosis. Okay? And then we have a thoracic, the other word, so lordosis is that C, right? And what's the other word? That opposes. What is my thoracic spine doing? The opposite of lordosis, which is? Yes, you can think of it, yeah, but it is kyphosis, right? So kyphos is the Hunchback of Notre Dame, right, with a K. K-Y, kyphosis. So kyphosis is hunched, right? So this is a normal kyphosis. Our thoracic spine has to be kyphotic. Why? Because we have all these things glued to it, right? And it is protecting a vital organ that's essentially gas. What happens if I puncture here? What happens? So if I stick a needle here, or if I stick something here, or if I fracture this rib, and they're always saying, oh, protect your ribs, right? Why? Because if I stick this guy into my lung, what happens? It's like a balloon. All the air comes out in the lung, so a pneumothorax is what it's called. And you don't want that because you will suddenly stop breathing. So this is, you keep the thoracic kyphosis. Why do we have a lordosis in our cervical spine? Think about a baby. How's a baby's spine? It's like that, right? The baby's all floppy, and why isn't he born with this like we are? Yeah, that's right. He has to fit in your womb, for one, but he doesn't need it, right? He doesn't need it because the baby's always like that. Then at age 2 months, when they start developing these muscles, what's the first thing that they do? They look to the world, right? Imagine if our cervical spine was like this. We wouldn't see anything, right? That's the reason why our cervical spine, and all the animals, think about all the animals. Think about your dog. Yeah. Exactly. So they're all curled up, and then they start developing the curvatures. The lumbar curvature doesn't develop until the baby starts walking. Okay? Why? Because he doesn't need it, right? Until he starts bearing weight. So this is to protect our thoracic cavity. This is to look at the world. And this is to do what? Well, we have all our guts here, right? And our guts, so it fits more space if we open it up. And if we don't, imagine if we had ribs in our abdomen, right? Well, I couldn't do. And every time you fill your guts with poop, I mean, where would that go, right? So exactly. So you need this to be open, right? You need your abdomen. Remember, we don't use our abdomen to have a six-pack. Our abdomen is to just enclose our organs. And then we have the final coccyx and sacrum area, where it's also a chakra, right? It's the first chakra. And why is that so important? Look at Charlie. And look at yourselves, and I know that, not all of you are moms, but think of males, think of animals. This is where we have the center of our reproduction, right? And that's why it's so important to keep it. This is where we propagate the species, right? This is where these are where our vital organs of reproduction are, right? And it needs to be protected. It's not because of the bladder, it's because of other important organs that are there, right? So everything has a function, and anatomy is only important because of its function. Now, anatomy is just knowing that this is the biceps, this is the triceps. Physiology is knowing what they do. It's not enough for me to know that the thyroid gland is here. I need to know much more interesting is to know what the thyroid gland does, right? So that's physiology, normal functioning. Abnormal functioning is called pathos. Pathos in Greek means abnormal. So pathology is where you study the wrong stuff, the stuff that can go wrong. We're not going to study pathology, but sometimes by knowing pathology, you will understand the physiology. So ultimately, what you're trying to do with your yoga patients, what you're trying to do with your yoga students is prevent. It's kind of the same thing. It's the same responsibility, you understand? You have a responsibility towards other people as a teacher, as an educator, as a nurse, as a mother. There is no more important, right? As somebody responsible for a group of people's well-being and activities, you have responsibility. You don't relinquish that. Well, I'm tired, I'm sick, but your children still need you. You have to be there. I don't want to go to work today. I don't want to do this night shift. Well, guess what? You have to, because your other nurse friend can't do it, and blah, 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 right? Or, boy, these students are driving me crazy today. It's the same responsibility, right? You have a group of people that you are teaching, that you are mentoring, that you are guiding, and it is your responsibility to make them have a good experience, right? A good experience, a healthy experience. So much of yoga you will only capture after staying, after regularly doing it, right? So you want these people to come back, not just because you want them to come back, it's because you care for the well-being of these people, right? When you say at the end of your class, the light in me sees and honors the light in you, you really mean that. You have a responsibility towards these people. It's the same as, I have towards my patients or I have towards my children, right? Okay, so we talked about those, and so if you can see, Charlie has something sticking out there that's really hurting him. Where is it? Show me, Jen. It's okay. So show me, Robin. Yeah. So for the other class, I said the same thing, and they pointed to the two arteries up it, which is fine because it's also in red, but these arteries are normal, right? So as they're coming up through. And the yellow things are the nerves coming out through your vertebral bodies there. And then the vertebrae are bones as well, but they're very special bones. See how they're like chunky and they're like, so these are for weight bearing to the point where this one, these ones, the lumbar ones, are bigger, tougher than the cervical ones that are very small, and those rotate on themselves, and they're responsible for mobility, right? Mobility. So if you look at this joint, you can see that this joint is much more mobile than this joint. Everything that is below our waist is weight bearing, needs to be strong, needs to be tough, needs to be restricted in place. Everything that's up here is for us to communicate with the world, right? So that's why you have a lot of injuries in the shoulders, and you can also have, and we'll talk about that. So I'm sorry, guys, so this is a disc. This is a herniated disc that is touching. It wouldn't be a problem if it didn't touch this guy here, right, is one of the lumbar nerves, right? And that wouldn't be a problem if these guys didn't hurt like the dickens, right? And they hurt like crazy. So that's what, if you've ever had big babies when you're pregnant, you have like pain and sciatica type pain because the babies press they press on the sciatic nerve, which is coming down from these nerves here, okay? So they're doing yoga all the time with these things, right? Wanting or not. Just today I saw a lady that had 2016, she's a little chubby, and it's almost like, man, you're never right? She was trying to do the right thing and exercise. Her daughter brought her up here from Vegas. She was lifting weights, and boom, one of these discs herniated into the nerve, and then she had a foot drop, and then, so it's like, geez, man. It's like, right? So, but this was a long time ago, but unfortunately, she has a permanent foot drop because of it. Mm-hmm. The foot drop is when you can't do this. You can't dorsiflex the foot. It's horrible, and you have to wear a brace. And in a certain way, it is preventable had they, diagnosed and had the surgery kind of soon enough, right? And yeah. Extruded, yeah, so it extruded. So this is a protrusion when it comes out a little bit, an extrusion when it comes all the way out. And so what happened, so this is a gelatin type of material, right? So the disc, this is bone, this is disc, this is bone, this is this. The way I explain it to people is the peanut butter and jelly sandwich, right? So you press on the peanut butter and jelly, that thing comes, and that's exactly the way it comes out. Right? And it can go into the spinal cord, which is a problem here, and it can go out to the nerves, and when it comes out, it generally comes out to the side, so a lateral, and that's where you have the pain. Fortunately, it hurts enough that you have to do something about it. Okay, but that's Charlie then.
If you're having neck pain, it could actually be from an injury
No, absolutely not. And I will... So the fibers, that's an important concept to understand. The fibers, the nerve fibers, the veins, but the nerve comes from cephalic to caudal. Caudal means your tail, right? And cephalic means your brain. So they go from superior to inferior. So if I have a lesion in the lumbar spine, I can't have symptoms in the upper part. If I have a lesion in the upper part, I will have problems with my legs. Why? Because the fibers run down the spinal cord. Okay? No, you can't. No, you can't. You have referred pain from, you know.
So it will be upper to
Yeah,
lower, not lower.
yeah. Having said that, sometimes in the abdomen, when you have an acute rupture of the spleen or something, there's a nerve that goes up, and you have referred pain in the shoulder from problems in the abdominal cavity. But that has nothing to do with what we're talking about. Okay? Okay, so scoliosis is a different issue, right? Scoliosis is a lateral deviation of the spine, right? And if the scoliosis is less than 20 degrees, so if this is 90 degrees, so less than 20 degrees, right. So a lot of people, 90% of our population, have mild scoliosis, especially females. Females have a lot more scoliosis than males, and we think that has to do with the growth spurt, to the point where in the high schools they do scoliosis triage and screening for young girls. One more reason to put your daughters in sports, right? And so that people need to be doing sports so that we can prevent these kind of things. If it's less than 20%, very rarely you will have symptoms. If it's more than 20% and you, over the years, it slowly but progresses, you have not only problems with the spinal cord, but what it does, it tilts your pelvis, right? Yeah, so it...
So everything I do on my right side is really hard.
Yeah.
And it's actually affected my knees. But I played sports in college too, so I have like frayed meniscus from all of the weight on my right
From favoring one side. And so when you have an instability of the pelvis, you will have problems not only in the pelvis, but you will have problems in the knee and problems in... So exercising and strengthening the muscles, so physical therapy, strengthening the muscles that are underdeveloped, on the underdeveloped side, right? So if your scoliosis is... if your scoliosis is this way, right? So lateral deviation towards... This is my left, right? So these muscles will be under, see how they're like relaxed? And these guys are stretched. And my pelvis would be, this one would be tilted this way, right? Nothing to do with what we're talking about. Okay? Absolutely, absolutely. Stretch the other side.
I know, I'm just making this about me. So if my right is higher, then I should be strengthening on my left side?
Right. So you will see, for example, Valerie in her class, foundation class, will say, one side is different than the other. So you all notice that. One gluteus is stronger than the other. One hamstring is tighter than the other. One adductor is you have more pain than the other, right? So what happens? You have to strengthen that side that's weaker, especially because we have very strong muscles that hold our spine together, several layers. They're called what? The paraspinous muscles, right? And these paraspinous muscles is what you can work with, right? Because the surgery is a humongous surgery. If you know a young teenager needs to have scoliosis surgery, it's a big deal. So I guess today we covered a couple of important concepts, right? This is just an MRI showing a cervical disc that's protruding and it's touching into the spinal cord. So this gray part here is the spinal cord, right? And that's where I talked about that symptoms coming from the neck will affect your legs, but not the opposite. Okay?
I don't know. I read that most of the yoga injuries are like in forward folds, like in the lower back.
Mm-hmm.
Why do you think that?
There are, you know, I don't know that that's more than anything. For example, when you're doing plow poses or when you're doing Sharangasana, right? I think what we have to worry a bit more is about your neck. The lumbar spine is a lot more forgiving and a lot of what you feel in the lumbar spine has to do with tension in the muscles and the ligaments and the SI joints and not so much neurological injuries, right? So
So if somebody did have protruding disc in the lower spine and upper spine, what would be a good pose or posture for them to do that could help alleviate pain or
right. So a lot of the things that you do, anti-gravity, right? So avoiding gravity. So positions that are your whole series on the floor, your floor series. All of those forward folds help to, relax and limber the lower back. All the forward fold. Right. Yeah. Mm-hmm. But what happens a lot is when people are doing forward folds, they do it wrong again. They do not activate the core. They do not bring their sits bones into position. And all they do is, right? And when it's really about this type of movement, right? So again, it's your obligation to teach them, beach ball in the abdomen. Because one important thing that we did not cover, and we will cover in the next, is the concept of agonist and antagonist muscles, right? You all understand that the agonist is the muscle that is doing the effort, right? So the biceps is the agonist, and the is the antagonist, right? So show me a forward fold there. Let's see. And then standing. It can be standing. It can be, yeah. There you go. So Jen is in forward fold. There you go. And Jen, you think about this. What muscles in forward fold are you activating and which ones are you relaxing? Let's say in the thigh, right? Yeah, so the hamstrings are the agonist, and which one is the antagonist? The quadriceps, right? So let's think about your spine there. What are you doing with your spine? Which ones are you activating? Let's say do a half lift, just as you are right now, right? Besides the fact that you're hyperextending your knees there, what muscles are you activating in your Yes, the paraspinous muscles. And which one are you relaxing then? Which one is the antagonist? No, because you're activating the whole thing, right? Because you're staying like a, right? Yeah. So the ones that you're relaxing, kind of not really, but the ones that you're not moving is your abdominal muscles. Okay? So do that better in forward fold. So if you're doing a forward fold, again, these guys, your abdominal muscles are relaxed, right? And your lumbar muscles, your whole paraspinous area there, is stretching, right? Okay. Thank you. And then show me a position where you would like stretch these muscles here. Yes. Yeah, right here. Or when you're doing the whole spinal strengthening series, right? Yeah, when you are doing your spinal strengthening series, these are the agonists and these are the antagonists. You are relaxing, which relaxing means you're elongating or you're stretching these muscles. We'll talk about isometric contraction and all that. Okay, guys, I think everybody's tired, and I'm sorry to have gone, but it's just there's so much to review and to see and to teach, and we haven't even gotten to the poses and the muscles. So next time I think we can't do more than 2 hours because everybody gets tired, but the attention span goes away. But I think we ought to try. I can't do it during the weekdays because I'm very busy, right, with work. And so we should probably try to aim for maybe a Saturday morning or even Saturday, whatever you guys can, whatever we can do.
Saturday evening or afternoon would be better.
What is a hiccup?
I don't know.
Right, so it's a spasm of the diaphragm. That's what a hiccup is. Mm-hmm.
I can do Sundays too. I don't know if everybody else can.
Yeah, I know. Yeah. So you guys discuss with Dasher when we can do a next session and what specific points. I want, again, just until page 112, right? Review it again, read it, ask, what questions do you have, put it down, and any kind of questions, right? Applied or non-applied or... Yeah, that page 112. Yes, sir. Yeah, we'll catch up tomorrow. No problem. Okay. I lose complete, I talk and talk and talk. It's just terrible.